Hi everyone, welcome to Kids Covery. Myself Dr. Prune and we are discussing pediatric nephrology. The topic of discussion in pediatric nephrology today is going to be renal hypoplasia and renal dysplasia. So what do you mean by renal hypoplasia? So renal hypoplasia means hypo means small. So there is a small kidney, and renal dysplasia means that there is a disorganized kidney. So renal hypoplasia belongs to small kidney, non-dysplastic kidney. Now since the kidney is small, so the number of calyx, the minor calyx, the major calyx, and of course the nephrons, okay, PCT, DCT, loop of Henle, collecting duct, all of them are going to be less. Why? Why does this occur? See, you all must be knowing that the kidney is going to develop, or the kidney develops with the help of metanephrons. The kidney develops with the help of metanephrons. Let me just show you this. So can you see? This one is the mesonephric duct, okay, and what is this? This is the ureteric bud which is there, and there is some metanephrogenic blastema also. So this metanephrogenic blastema is responsible for formation of major calyx as well as minor calyx, major calyx as well as minor calyx, okay. So because of the defect in the metanephric renal blastema, the renal development does not take properly. Why? See, one, there can be some genetic mutations that are involved in the development of kidney. Other things can be the vascular abnormalities in utero. For example, if the female is having the uteroplacental insufficiency, okay, if the female is having what? Uteroplacental insufficiency, okay, or there is decreased blood flow, okay, if the renal blood flow is decreased, then also this can happen. Now, the prime motive of discussing this syndrome, of this topic, renal hypoplasia, is that it has got a syndromic association. This is an X-linked recessive disease which is called as Prune belly syndrome. It is called as Prune belly syndrome. Prune belly syndrome is a triad of lack of the anterior abdominal wall muscles. There will be undescended testis will be there, and there will be renal dysplasia which is going to be there. So the kidneys are not functioning properly, called as renal dysplasia. Then the testis are undescended, and of course there is abdominal wall which is absent abdominal wall muscle. So can you see, the abdominal wall muscles are not there. That's why if you compare, this side of abdomen is taut, okay, but this side of abdomen is not at all tough. Okay, you got it. So anterior abdominal wall deficiency, urinary tract abnormalities, and of course the kidney is going to be involved, and the third one is going to be cryptorchidism. That's why in the antenatal life there is oligohydramnios which is going to develop. Okay, oligohydramnios. Now the problem is that the calyx and everything is very less. That's why there will be very less urination which is going to occur. The kidney is not going to able to perform at its best, and that's why it has a high chance of progression, because the kidney is not removing the toxins outside. The toxins are accumulated inside, and because of accumulation of toxins, that leads to end stage kidney disease. That causes end stage kidney disease because of focal segmental glomerulosclerosis. So understand that as the toxins are going to develop, the kidney is going to get damaged, and this damaged part is going to show sclerosis. This is called as FSGS, focal segmental glomerulosclerosis. That means there will be decreased work of kidney. Okay, so kidney will not be able to work properly, decreased work of kidney, and because of the decreased work of the kidney, what is going to happen? There will be end stage renal disease. End stage renal disease that is going to happen. Got it? Great. And in the treatment part, please understand, see, ACE inhibitors are something which are nephroprotective. Okay, ACE inhibitors are something which are nephroprotective, which are kidney protective. So you can give the ACE inhibitors. All right. So this is the end of this class. Thank you so much for joining, and we'll see you in the next class.